So diabetes, basically, it's an endocrine and metabolic disease, as we call. So it's a problem with blood sugar. So we all know that sugar is a very important substance in our body. We cannot live with the sugar. However, sugar has to be at an optimum level, not too high, not too low. So it has to be within the certain levels. So when the sugar goes high and stays there as a high sugar for a period of time, and then we call them diabetes. Usually we check 3 times. If the sugar is elevated, then by definition we call it diabetes. So type 1 diabetes is somebody who does not produce insulin. So it usually happens in a childhood. Sometimes people have viral infections and several other injuries to the pancreas. When the beta cells fail to produce insulin, that's type 1. But type 2 is the one that we most commonly see, in which people do have resistance to the circulating insulin in the body. It can come from obesity, improper food choice, and sedentary lifestyle, and other factors that can cause diabetes. Prediabetes actually puts you at a risk for getting diabetes down the road. So prediabetes is a state in which you have to be very careful about what you do, what you eat, and how your weight is going. Losing weight, getting a good low carbohydrate diet, and regular exercise are the key things. If you have some other medical conditions, including high blood pressure, kidney disease, those has to be watched carefully and managed properly as needed. Basically, type 2 diabetes is actually causing insulin resistance in the body. So whatever insulin that you have, the cells are not able to use the insulin to use the glucose properly for the matters of cellular nutrition. Short-term complications are elevated blood glucose, and which can cause infections. So people can go into, if the sugar is very high, they can go into mental status changes, alterations in mental status, and they can lose orientation, and there's a condition called diabetic hyperosmolar coma. People can even go to coma because of very high blood glucose. So long-term complications of type 2 diabetes are many. It covers from head to toe. If we start talking from the head to toe, we can start from the eye. So it can develop early cataract, or rather we can say premature cataract. It can cause retinopathy, which is hemorrhage in the retina, in the back of the eye, that can eventually lead to blindness. It can cause carotid artery disease, which is the arteries in the neck. Diabetes along with cholesterol, they can cause plaques, and those plaques can cause strokes, disabling strokes. It can cause arteries of the heart can be hardened along with the cholesterol, causing heart attacks. It can go to the kidneys. It can cause losing protein in the urine, and eventually that leads to chronic kidney disease, and eventually end-stage kidney disease requiring dialysis. In terms of the legs, it is a big risk factor for peripheral arterial disease with or without atherosclerosis, and that can cause gangrene and requiring treatment for infection, cellulitis, and some people actually require amputation of the toes and followed by different parts of the legs. That is a known complication from diabetes. So we can control diabetes in different ways, depending upon what level are we talking about. If you are just diagnosed with diabetes, if you just have diabetes, and if you don't have any other problems, then watch your diet, watch the exercises that you do, and watch the way your weight is going. Losing weight, doing regular exercises, and controlling diet is the number one option for diabetes, no matter which level are you at. Even if you have a very high level of glucose, very much uncontrolled diabetes, still the lifestyle modification, your diet and exercise, that plays a significant role in controlling diabetes. After doing that, then comes the medications. Metformin is the main medication that we use to control diabetes. a particular type of metformin that you take, those problems can be solved. And then several other medications that we use. And if those are not giving good control for the diabetes, then comes the role of insulin. Insulin can be given in short-acting as well as long-acting insulin. And basically, monitoring glucose is the most important thing when people are on medications as well as insulin. Checking the sugar before the meals and taking appropriate doses of insulin are very important. Some of the newer agents for diabetes that we use nowadays, they also help people lose weight. Most of them are injectables. Some of them are weekly injectables, not very difficult to use. Lifestyle modification, the oral tablets and the injections, that's how we control diabetes. Concept of A1C is very important in terms of understanding diabetes. So this test has another name called glycohemoglobin. That means the two words are here combined, glyco and hemoglobin. That means glucose is connected to the hemoglobin. More glucose you have in the bloodstream and the longer period of time your glucose is elevated, that combines with the hemoglobin to give a percentage called hemoglobin A1C or glycohemoglobin. Someone asked me a question that, Doc, my state was not fasting. I was not fasting on the day the test was done. Will that affect the numbers? Should I have a higher number if I have not fasted? Or I had a birthday party last night when I ate cakes and goodies. Will that affect my hemoglobin A1C? Answer is no, because hemoglobin A1C will detect how good or how bad was your hemoglobin over the last 3 to 6 months. Another concept in diabetes is the glycemic index. You may have heard about the glycemic index, which actually this concept developed, I think, over the last 3 decades or so. So glycemic index is categorizing different type of foods in terms of how quickly and how high the sugar goes after they ingest a food product. This does not, the food containing proteins heavily like meat or seafood or poultry, that does not fall into the category of glycemic index. It falls in the category of the food that has significant amount of sugar content. So they're categorized into 3 different type of categories, into mild, moderate and high glycemic index foods. So mild is like a food that has a lot of fiber in it. For example, if you eat an apple, that is a low glycemic index, because apple, if you eat an apple, it's not very quickly the sugar will go into the bloodstream. On the other hand, if you drink an apple juice, that has a very high glycemic index. Some of the juices that you will see, they have high fructose corn syrup. So high fructose corn syrup is a very high glycemic index, so it can go very high. So watermelon has a very high glycemic index because watermelon does not have enough fibers. At the same time, if you look at wheat, whole grain or wheat or oat, they have a medium glycemic index. On the other hand, if you eat white rice or white bread, that has a high glycemic index. So how does that high glycemic index or low glycemic index food, knowledge about that helps us? This helps us because that's how we can control our sugar better. Number 1, we can lose weight. And number 3, some people have fatty liver. It helps in those situations as well.